Hello, and welcome to Hand Hygiene, Key Operational Strategies. The purpose of a solid hand hygiene process is to ensure that you have a policy and procedure that outlines the guidelines, directions, as well as a solid system for proper hand hygiene for employees, residents, visitors, and others in the facility in order to prevent the transmission of infections whenever possible. Hand hygiene is required in order to reduce the spread of potentially dangerous infectious agents and to reduce the risk of colonization or infection for healthcare workers that could be potentially acquired from the residents. In the State Operations Manual, Appendix PP, the Guidance to Surveyors for Long-Term Care Facility, under F880 Hand Hygiene, the definition indicates hand hygiene, which is described as hand washing and/or alcohol-based hand rub, consistent with accepted standards of practice, such as the use of alcohol-based hand rub instead of soap and water in all clinical situations, except when hands are visibly soiled, for example, blood or body fluids, or after caring for a resident with known or suspected Clostridium difficile or norovirus infection during an outbreak, or if the infection rates of C. difficile infection are high. In these circumstances, soap and water should be used. According to the CDC, strict adherence to glove use is the most effective means of preventing hand contamination with C. difficile spores, as spores are not killed by alcohol-based hand rub and may be difficult to remove even with thorough hand washing. Ensure that your alcohol-based hand rub product is 60 to 90% ethanol or isopropyl containing preparation that is designed for application to the hands to reduce the number of viable microorganisms. Staff must perform hand hygiene even if gloves are used before and after resident contact, before performing an aseptic task, after contact with blood, body fluids, visibly contaminated surfaces, or after contact with objects in the resident room, after removing personal protective equipment such as gloves, gown, face mask, after using the restroom, and before meals. Hand hygiene continues to be the primary means of preventing the transmission of infection. When performing hand washing, wet hands first with clean running warm water. Apply the recommended amount of soap and rub hands together vigorously, at least for 15 seconds, although some states indicate 20 seconds. Make sure to cover all surfaces of the hands and fingers, and then rinse hands well with water. Dry thoroughly with a disposable paper towel, and then turn off the faucet with a disposable paper towel. It will be important for all staff to remember the importance of hand hygiene for the residents. And if residents need assistance with hand hygiene, staff should assist the resident with washing hands after toileting, before meals, as well as the use of alcohol-based hand rub or soap and water at other times whenever indicated. So what is your system for hand hygiene? Do you have a policy and procedure? Has it gone through your quality assurance committee? Is it consistent with best practices? Do you have adequate supplies, and who monitors that? Have you observed to ensure that your supplies and your sinks are readily accessible in appropriate care areas, such as where food and medication prep are happening? Policies and procedures consistent with best practices and regulatory compliance are going to be important. So you're going to want to take a look to ensure that you have an updated policy and procedure. Next, education. All staff in all departments, education and return demonstration. Volunteers will need education on both hand washing and alcohol-based hand rub. Residents. Residents are encouraged to perform hand hygiene before and after meals, after using the toilet, and at other times when hands may be soiled or carry infectious organisms. And visitors, it's going to be important to provide instruction, and you can provide written instruction recommendations as well as the use of alcohol-based hand rub and hand washing near the entrance where you have alcohol-based hand rub located. The CDC provides resources for education on hand hygiene with free continuing education. Please take advantage of the free resources provided for best practices. In summary, hand hygiene still remains the #1 measure in the prevention of transmission of microorganisms that cause disease. A good facility system with clear policies and procedures, staff education, and follow-through will be essential for quality.